And welcome, ladies and gentlemen, to this very important day, the 9th of August 2021. Very soon we'll be joining our Premier with a live update of what's happening. Well, today we'll be talking also about lots of functions and events that have been put on hold, cancelled or postponed. So it is trying times, as we know that in Queensland, the restrictions have been lifted, but we still are operating under the rule of previously, where we had to have the mask on, and of course community functions and events can go ahead under those current circumstances. So what it means is maybe no large scale events, but smaller ones. Venues can go ahead with the functions with the 50% capacity and those 4 square meter rule, and all those and much more coming up in the news today. Well, first of all, let's look at the announcement that the Premier made yesterday, not today. Very soon we will be joining her. We'll be bringing her right in from these studios.
Okay, well, we've got some good news today for the 11 LGAs, and thank you for all the families, everyone who's been doing a great job. So the lockdown will end in those 11 LGAs, but some restrictions must stay in place for the next 2 weeks. So it'll end at 4 p.m. today, but we're not out of the woods. So I just want everyone to have a really good understanding that we are dealing with the Delta strain. It's highly, highly infectious, and I can tell you from my conversations in Tokyo with people from around the world, this strain is sweeping the world. So we need to make sure we are making some extra precautions, and I'll go through those with you. So for the next 14 days, one of the key areas is in relation to schools. So the schools will reopen, but we do know that with this outbreak, with the high school students, we are now going to make sure that all school staff are wearing masks, and that includes childhood staff as well. They're also going to be given priority for vaccination, so the Health Minister will go through that in a moment with you. Now, all high school students will be required to wear masks at school. Now, can I tell you, in other parts of the world, this is exactly what's happening. I know it's happening in South Australia, and from memory, I think Victoria also has done this. But for our high school students, I please need you to wear masks, because you will be helping to keep the whole community safe. And this is because we've got the Delta strain, and until we can get to those 70 and 80% of vaccination rates, masks are absolutely critical. These masks are absolutely crucial because they are your protection against the Delta virus as well as getting the vaccine. Okay, so what it means for everybody else. So let me just run through this so everyone's clear. And this will be on our Facebook site, and I'm quite sure it'll also be distributed by the media as well. But we've done a roadmap, so it's going to be very clear for everyone. So you'll be able to have, this is for the 11 LGAs, up to 10 people in your homes. Okay, so that's including those who live there, and in public spaces. Now you are able to go and visit loved ones in hospital and aged care. We only have 5 new cases. 1 is detected in hotel quarantine, and 4 are local community cases, but they're all in home quarantine, and they're all linked to that Indooroopilly cluster. So that's fantastic news. That's the sort of news we want to wake up to. So we now have 12,364 people in home quarantine. We have 153 active cases. We've had 26,394 tests in the last 24 hours. So again, good testing numbers. But of course, Queensland, we've got to keep that up. We absolutely must. If you have any symptoms whatsoever, please go and get tested. And Queensland Health did over 3,500 vaccines in the last 24 hours. And in Cairns, we don't have the private testing numbers back yet, but we have 971 tests that were done yesterday in Cairns, which is fantastic. Now, Dr Young has also informed us some very good detective work in Cairns overnight. So they've actually linked the taxi driver with the marine pilot. So the marine pilot actually travelled in that person's taxi. So A lot of contact tracing is now happening, of course, with those exposure sites, but it's great to know that linkage has been done. So honestly, great work by our Queensland Health staff into home quarantine as quickly as possible to keep that community safe. And I know that the Cairns community will step up, just like the Townsville community stepped up when they had to as well. So I congratulate everyone for doing the right thing there. And of course, Queenslanders in the southeast of those 11 LGAs, please make sure you have a look at that roadmap and please continue to do the right thing. It's really important to be checking in using your check-in app. It's important to get tested if you are feeling sick. And of course now the high school students are wearing masks, and I thank them all for doing that. And from all reports from education, there's been no issues with the distribution of masks there. Okay, Dr Young will also address, there's been some questions about community sport, and it does include not just school community sport, school age, but it also is adult community sport as well. So it's the next 2 weeks, but she'll address that. Now, I want to talk to you about some good news about where we're standing today, and of course that's the Brisbane Convention and Exhibition Centre. And what we're doing is we're opening this as a mass vaccination centre, which will be starting this Wednesday. So we're getting a sneak preview today, and thank you to the staff here for being so quick in setting it all up with Queensland Health. Now, the federal government is responsible for 70% of the vaccination of Queenslanders. Queensland government is responsible for 30%. So what we do know is we're getting on some of that, that Pfizer is going to be coming on faster over the next couple of weeks. So from Wednesday, this convention centre will be open from 8:30 till 4:30, and we are now asking people, if you are between 16 and 59, you can now register on the Queensland Health website. Now, of course, a lot of people will still be going to their GPs or the pharmacists to get their vaccine. I've just heard, I think, that the Commonwealth Government has also approved Moderna, so we'll be getting more information about Moderna. But this is a great centre here for people who are already on that waiting list from Queensland Health. You will be prioritised, but as we work through that list, now we are opening it up for anyone between the ages of 16 and 59. And on top of that, there'll be free parking here as well, which is fantastic. Now, please don't just turn up. This is not walk-ins. You must be registered and you'll be contacted by Queensland Health. But we want to see as many people in Queensland vaccinated as quickly and as safely as possible. So there are now additional options that will be open. So that's fantastic news, and we're looking forward to seeing this open, and it will also be open 7 days a week, and it will be open on the weekends as well. So please hop on that website today, register, make sure you do it, do the right thing. You're not only protecting yourself, you're protecting your family and you're protecting your community. So with those few words, I'll hand over to Dr Young, and then we'll... Hop on that website today, register, make sure you do it, do the right thing. You're not only protecting yourself, you're protecting your family and you're protecting your community. So with those few words, I'll hand over to Dr Young, and then we'll do some questions afterwards. Thanks. Thanks, Dr.
Thank you, Premier. So excellent news overnight. All of our cases were in quarantine during their entire infectious period. So that one person who returned from the Philippines and went into hotel quarantine tested positive, so we're all used to that. And then our 4 community-acquired cases related to the Indooroopilly cluster, who were all in home quarantine during their infectious period. One of those, so I'll go through those 4 cases. One of those is a staff member at the Ironside school, so we're still seeing first-generation cases. We all have to remember that the incubation period is 14 days, so it's really important that people, all of those 12,000 people, do stay and adhere to that quarantine as we go forwards. Then one was a parent related to a child who attends Ironside. Another is a household contact of someone who attends Brisbane Boys Grammar School. And the fourth is another household contact of someone who attends Ironside. But the important thing to note is that the incubation period is 14 days. And unfortunately, that means that anyone who's in home quarantine, if they become positive, that entire household then has to remain in quarantine for another 14 days. So this is a lengthy process that we all have to work together to get through. Now, there are some... Whoops. I'm losing my... Right, I won't touch it. There are some... there have been some questions, I'll put it that way, raised about community support. Now, it's really important for the next 2 weeks that people do what they did over those 8 days. So just think, is this really necessary? So if you're questioning whether you can do something, then probably you can't. So for community sport, it is fine for up to 10 people to gather in a public place, but you must wear your masks, you must keep social distance, and you can't come into contact with people. That's really, really important. So if your sport is one that involves contact with other people, then it can't go ahead. But if it's golf or tennis and you've got a small group and you maintain that social distance and you wear your mask unless you're strenuously exercising, then it's fine to go ahead. And the same with indoors. If it's a dance class and there's no contact between the dancers and there's one person, maximum one person per 4 square metres, that's fine. So, and then people have asked about bridge. Well, the same thing. If you've got, you can have up to 10 people in your home. We know that. Or if you're going to a commercial venue, you can have one person per 4 square metres. So people have done this so well, and I'm sure they can sort out going forward what they can do in terms of community sport. What I don't want to see is kids from a whole lot of different schools all coming together, because we know that that led to a significant part of this most recent outbreak that we're still working through. We had that karate class, for instance. So it's really important that people use their common sense, as they've done so beautifully over the last 8 days. And this is for the next 2 weeks, while we just make sure that we don't have any cases that are out and about in the community, because we're only just started to have those days of 0 cases infectious in the community. That's really important for South East Queensland. Then for Cairns, it's vital that you are now in lockdown for 3 days while we work out all the contacts of this taxi driver, and we go back and reassess all the contacts of that pilot who brings ships in through the reef. So clearly we've found on whole genome sequencing that the taxi driver acquired it from that pilot. We suspect it was when he drove that pilot from his home to the airport, and that pilot then flew down to Brisbane. So we're just going back and checking all of those contacts and just making sure that we have all of them. So it's really, really important that people in Cairns, any symptoms at all, don't wait for a call from Queensland Health. Just come forward and get tested, and the numbers yesterday were magnificent. People did exactly that. So thank you very much. It's really important going forward so we can find if there's any other clusters of cases or any other chains of transmission, so we can manage them as quickly as possible. Then down in the Gold Coast, we do have that one case down there who did test positive. So for the Gold Coast, it's really important that you also, any symptoms at all, please, anywhere in the Gold Coast, come forward and get tested. And that's really important to do today as we just work through what the risks are from that particular individual who came forward so quickly to get tested. So all of those things just need sorting, but the general message of course remains the same. It doesn't matter where you are in Queensland, we have no idea where this virus is next going to pop up. So please, any symptoms at all, don't think it's your normal hay fever or normal whatever, just come forward and get tested. So we had 26,000 people do that yesterday. Earlier last week we had over 50,000 people. So please, it's really important we continue those numbers. Thank you.
Live coverage coming
Here in
all
the
the way
southeast,
from
we
Brisbane.
continue to see the kind of trend that we'd hoped to see: a decreasing number of cases, all linked, all in quarantine during their infectious period, and a continuing high testing rate. From here, our defences rely upon those more than 12,000 people in home quarantine, as well as our border restrictions attempting to contain cases from coming from other states, and the other restrictions in our community: social distancing, QR codes, wearing of masks, and for the first time students in schools wearing masks, and increasingly vaccinations. It's wonderful to be able to reach the milestone where we have sufficient vaccine supply to be able to open up these kind of mass vaccination centres, like here at the Brisbane Convention and Exhibition Centre, for Brisbane folk to be able to get an appointment and a message to say they have an appointment, be able to drive in, park for free, come up here, be greeted by our wonderful health staff, get their vaccination and be on their way again, is all about making vaccination as safe and convenient for thousands and thousands of people as we possibly can, which will supercharge our vaccination rate, which is exactly what we're trying to do. For those in Cairns, everyone in the southeast is thinking of you. We know what you're going through. We've just been through it ourselves. We are aware that some of the supermarkets are experiencing challenges with the number of their own staff who are now considered close contacts. And so I just wanted to thank our supermarkets for the great job they're doing, the shop assistants and shop workers who are doing a fantastic job, and really just urge people to only buy what they need, only go shopping alone rather than in groups, and to please be patient.
So
Live
great
coverage
news
from
again
Brisbane
today, and thank
Convention
you to
Centre.
Cairns. We hear it's quite very quiet up there at the moment, so everyone's doing the right thing and staying home. I do want to just do a shout out to businesses. The current level of restrictions are 1 per 4 square metres. A lot of the images we saw last night of venues opening back up and everyone going out and enjoying themselves, it does look like a number of businesses are operating at full capacity. So I do remind businesses that 1 per 4 square metres, one is lawfully required, but it's so important. If we do this right for the next 2 weeks, we can ease restrictions further, but we have to make sure that we've got that social distancing happening at our venues. So by all means, go out and support our cafes and restaurants and businesses, but remember, we all have an obligation to socially distance and have that 1 per 4 square metres. Now today, opening the Brisbane Convention and Exhibition Centre on Wednesday, us being here for a sneak peek today is so exciting, and I thank Metro South Hospital and Health Service and everyone who's been involved in getting this up and running so quickly. We've been able to bring this forward because of the extra visor that is coming this week. Now, we don't have it yet, so we'll start on Wednesday with about 1,000 to 1,500 vaccines a day. And when we get that extra vaccine, which is due on Friday, we hope to be doing 3,000 a day by the weekend. So we'll have a lot of staff on board, and we remind people this is not a walk-in venue. You must book. But to get a booking, you must be registered. So today, we open up for 16 to 59-year-olds in Queensland, not just here in southeast Queensland, but across Queensland. Jump online and register on the Queensland vaccination website. You have to be in it to get it. If you're not in our register, we can't offer you a booking, because in the regions particularly where we have vacant booking spots, because we've done many of our 1B group, we don't want to see any booking slots sit empty. We want every jab going into an arm each day. So here's your chance. Get online and register, and as booking slots become available, you will be invited to take up one of those booking slots, which could be here at the Brisbane Convention and Exhibition Centre. We have also organised that if you are here for your vaccination, your parking will be free. So that's really important. You don't have to worry about the cost of parking here at the Convention Centre if you are getting a vaccination. So we can't wait to see this place buzzing from Wednesday and lots of people getting their vaccination. So don't wait, jump online today
and register your interest to get a vaccinate anywhere in Queensland. Thank you.
Live coverage coming from Brisbane Convention Centre.
Morning.
Report from
so
the Police
as
Department.
you've heard, we've transitioned to the next phase of our operation with the lockdown in South East Queensland ceasing yesterday and the lockdown in Cairns commencing as well. We're very pleased with the level of cooperation we're seeing in Cairns at the moment. So the engagement between our agencies up there, the local councils, and in particular Yarrabah Council, has been very good. So the message to all of the community up there is please make sure you abide by those restrictions as they are. Operationally yesterday, obviously with the ending of the lockdown, we did intercept less vehicles, but 1,040 were intercepted and 21 persons were issued with fines for not abiding by the
We leave that the live coverage there. That was coming live to you from all the way from Brisbane Entertainment Centre, which will be open from Wednesday. And so from Wednesday it will be that hub, and as has been said, that you should go online and register for that right now. Well, as the police department there was discussing Cairns. So let's take a look at what is actually happening in Cairns.
Well, people are certainly very concerned about this COVID-19 case in Cairns. We know he's a 60-year-old taxi driver from the Cairns suburb of Canimbla. He was infectious for about 10 days and showing symptoms. He's not vaccinated, and he was picking up around 20 to 30 people each day and delivering them to various locations around Cairns. He also visited several venues, including the Brothers Leagues Club at Menunda, a Woolworths at Menunda, and also a 24-hour medical centre in Cairns. So the case has thrown Cairns and the Indigenous community of Yarrabah into a snap 3-day lockdown. That came into effect from 4 o'clock yesterday. That basically means that we can only leave home for groceries and medicine, exercise within 10 kilometres of home, and of course leave home for a COVID test or a vaccination. It's also mandatory to wear masks both indoors and outdoors. So health authorities are throwing everything they can at this. A pop-up clinic was established on the Cairns Esplanade yesterday. I had the opportunity to speak to a few people down there from a very safe distance, Lisa, and with a mask on. One of the people that I spoke to was Robin Heath. He's a taxi driver. He said he's terrified about the situation. Here's what he had to say.
This comes as a complete shock to me, and it appears that people were not prepared. They hadn't put any thought into what to do. So now I'm on my way to get tested, because as a taxi driver I'm very concerned. The spread of people in a taxi is a lot of people over 10 days, probably amounts to hundreds or thousands.
So how would you describe the community reaction then? We get a sense of it certainly from that taxi driver.
Absolutely, Lisa. And look, I think the lockdown has definitely caught a few people by surprise. The Queensland Premier Anastasia Palaszczuk made the announcement at 10 o'clock yesterday. By 4 p.m, all the restaurants had closed down. Everything across the city had closed down. The streets were quiet. And Lisa, I guess, we have been very, very lucky up here in Paradise during the whole pandemic. Really, we've had...
Yes, really, they have been a bit lucky there, but the reason for this lockdown is that it is going to be acting as a circuit breaker.
Then Cairns. So thank you very much to that gentleman in Cairns who works as a taxi driver, who came forward and got tested on Friday afternoon, and we got that result late yesterday. I've always been a little bit worried about Cairns because we had the Marine pilot there who was positive in the community. We haven't seen any other positives from that pilot, but yesterday morning I asked people in Cairns to please come out and get tested, and I asked people in Cairns again. It's really, really important. Any symptoms at all, don't second guess yourself. Any symptoms at all, just come forward and get tested. And the Hospital and Health Service...
Yes, and that message could not be any clearer. Come forward and get tested. Look, in Queensland, we are looking at these low numbers, while in New South Wales, 262 new cases were being recorded.
Good morning, everybody. To 8 p.m. last night, there were just over 95,000 tests done in New South Wales, and it's really important, as we always say, to keep those testing rates high. To 8 p.m. yesterday, there were 262 cases of community transmission, with at least 50 of those infectious in the community during that time. And as we've seen in the last few days, the numbers are bouncing around a bit, but clearly we need to reduce those numbers. And I urge everybody to please stick to the rules, follow the health advice, and only leave home if you absolutely have to. Unfortunately, overnight there was one death of a woman in her 80s who was not vaccinated, and Dr McAnulty will provide further information about that. In relation to the virus, Canterbury Bankstown local government area still remains the epicentre of the most cases. Obviously, all local government suburbs within the Canterbury Bankstown area and adjoining areas are under risk of transmission. It's again creating the highest number of cases, and as Deputy Commissioner Warboys will outline, that has been the focus also of police compliance with extra presence on the ground, making sure people are doing the right thing. On a more positive note, health experts advise us that if people in the Georges River local government area come forward for higher rates of testing in the next few days, that local government area is likely to be taken out of an area of concern. So can I please urge everybody who lives in the Georges River local government area, especially in those suburbs adjoining the local government areas of concern, please come out and get tested if you have the mildest of symptoms. That will give the health experts confidence to take the Georges River local government area out of those areas of concern. And congratulations.
And that will be good news that that area has then been taken out of the restriction zone. Well, right now let's take a look at some of the what I'd say community comments. So comments that have been coming up on our post and on our live stream. Debbie Kamaraj is saying that good morning everyone, have a blessed day and safe week. JP Soni Kemcho, he's saying it is very good advice from him. It says try to stay indoors, no loafing, saves life in wear a mask and when you're going outside your home. Good, very good advice there from JP Soni there. And of course, Sardar Kamarjit Singh, Sat Sri Akal ji, very good advice from him as well, is saying coronavirus doesn't have legs. It just keeps traveling with people and spreading it. Please stop people who are affected and isolate them. Keep safe. Virus is here to stay in Australia for long. And I couldn't agree more. Yes, it is here and it is here to stay. We will need to just learn to deal with it, and very well said there. Very good. So, good advice. And Chandradas, a very good advice from him as well is that everyone please do get vaccinated. So, it's good to see the community comments coming through there as well. Well, right now we've looked at Cairns, we've looked at Queensland. Right now let's go to Penrith and see what's happening there.
Premier mentioned additional restrictions for 12 suburbs in the city of Penrith. Now we've seen the front of the epidemic move into parts of Penrith adjacent to the areas in Western Sydney and southwestern Sydney. So we're concerned, and the additional restrictions will help contain that outbreak emerging there. The suburbs affected, which are adjacent to Cumberland and Liverpool LGAs, Caddens, Claremont Meadows, Collyton, Erskine Park, Kemps Creek, Kingswood, Mount Vernon, North St Mary's, Orchard Hills, Oxley Park, St Clair and St Mary's. In line with the restrictions currently in place in Blacktown, Campbelltown, Canterbury Bankstown, Cumberland, Fairfield, Georges River, Liverpool and Parramatta LGAs, people in these 12 suburbs must only obtain food or other goods and services and exercise within 5 kilometres of their home. You can't travel to other areas of work outside those areas unless you're an authorised worker.
So there you are, that's an update there from Penrith as well, sticking into that area. Last of all, but we'll take a look at Victoria and get an update from Premier there on what's happening, because they've been talking about AstraZeneca.
What I can announce today is that from tomorrow, 9 of those 50 clinics will offer AstraZeneca vaccine to 18 to 39-year-olds. They'll be able to go online, book an appointment, and there are many appointments available. We've got the best part of 200,000 doses on hand. They'll then have a conversation upon arrival with a doctor. The doctor will take them through the risks, take them through all the different issues that they need to consider. If they then make an informed decision and provide consent, they will receive the AstraZeneca first dose, and then some 12 weeks later they'll receive the second dose. There's significant protection from infection and therefore from transmission and ill health from just a single shot. Obviously we want everyone to get the 2 jabs, but it is a powerful contribution, and I would fully anticipate that those 9 sites will be very busy, as all of our state sites have been right throughout this vaccine program. There's a lot written and a lot said about people being hesitant to get the jab. That's not the experience that I'm seeing. It's not what I'm picking up on. I think there are many millions of Victorians who want to get vaccinated. They want to get vaccinated quickly because they know it's good for them, for their family and for every family. And it's critical to us being open and staying open. So I think that those appointments will be snapped up quickly, but there are many of them. And we'd anticipate there's no supply issue when it comes to the AstraZeneca vaccine. You would book, you turn up, you have a conversation with the doctor, you then provide consent if that's your choice. Having had the conversation with the doctor, you'll then get your first dose and the second dose some 12 weeks later. I think there'll be many, many people who will avail themselves of that from tomorrow.
So I hope that what he meant there was that many people will take up that offer, and I really, really do hope that people do take up that offer because when all those arrangements are being made, it's no use unless anyone takes that offer. So as we've seen today, we've looked at some of the community comments. So I'd like to welcome everyone to put your comments, and if there's something you'd like to discuss, you can even connect to the studio as well. From tomorrow I'll put on a number as well. If you really need to discuss some burning top issue, we can bring you here by phone. I can bring you here by video link as well, and we can discuss some of the points there. Well, right now let's go to that Brisbane Entertainment Centre once again for the tail end of that interview where it is now question time.
Because Moderna, you don't have to dilute, you can just draw up, so it makes it much easier. So that's why we're focusing on Pfizer. It's just a slightly more complicated vaccine. It needs different storage requirements, all of those issues. Whereas AstraZeneca is a very easy vaccine, so why wouldn't we get people who vaccinate all day, every day, brilliantly? I mean, our local pharmacies have been vaccinating for flu since 2012 in Queensland. They're very good at it. And I actually spoke to the Pharmacy Guild. I think it was one of the first things I did at the start of this pandemic back in January last year, and said, do you think you could please get all your pharmacies organised so when we one day get a vaccine that they can go and vaccinate? And they did it. They did it brilliantly.
So there's the talk about the Moderna. So this will be the third vaccine that will be coming in, and Queensland is going to give it a seal of approval as well. Well, right now we've been talking about functions and events. Well, of course, one of the big events, India Day Fair, has been postponed till October. So, 23rd of October, it is going to be the big day. The reason for shifting it up to there is because it will give a good opportunity for these, control measures put in place. We could hold it now, but it's no use having an event like that with a handful of people after so much effort that's been put in. But the good part is, because as per plan, it was going to go this weekend, and our Story Bridge has already been lit up, and of course the banners have already gone up. Take a look at this scene around Story Bridge. The background music is by Brisbane Bounce Back. Where's the party tonight? So it was wonderful to see in our Copia Queensland's flag up the top. So if you see right on the top there, it is wonderful, wonderful thing to see there. Well, right now we got the messages once again from the Devika Maharaj, one of our very staunch and loyal supporters. So thank you so much. And she says, thanks Chantas Multimedia and Uncle Meshana for the excellent daily live updates and external excellent streaming. And Chandadas also says that the streaming is excellent. So thank you everyone. So, tomorrow we'll bring to you the new flyer with the date, except mark the date, 23rd of October, same venue. And hopefully, God permitting, with everything going okay, we will be back there in a bigger and better manner. By that time, the restrictions would have been under control. And that is, of course, hopefully. And tomorrow, we will hear from the Premier and Lord Mayor on the update of the Olympics. They really wanted to focus on the health issue, which is quite understandable. And it is good that that's been done first. And tomorrow, they will be making an announcement on the Olympics and moving forward. So once again, it's wonderful to see you all once again here. Right now, I'll say goodbye until tomorrow. And it's been wonderful to have your company.
I know you want it, but you're never gonna get it, baby. kabhi naani mane na mane koi duniya ye sar mere ishq ke hai deewani. Hey you, I know you want it, but you're never gonna get it, meri hath kabhi naani mane na mane koi duniya